Is Dr. Jen from drjenmed.com. Today is story time with Dr. Jen. I'm sharing a case of a patient, about 40s, yeah, mid 40s, female patient who came complaining of numbness, tingling in her hands and feet. That had been going on a few years now. Now, this patient in particular lives between America and Jamaica. So she traveled to and fro, right? And when she's in the States, she gets her medical care. And this had been going on a little while with this numbness and tingling that was getting worse. And sometimes it caused pain. It had reached now over the years to the point that her hand would feel weak. The grip to hold stuff, it felt like stuff was dropping out of her hand. She also said like the feeling, especially in our toes, is like it was coming up our foot to our leg, our ankle, and then up the leg. Same thing in the hands. Start with the fingertips, but it was going up like to the wrist. Now, this is very classic for peripheral neuropathy, which means nerve issues, of your extremities, right? And as you can imagine, in America, they did every test, every MRI, every blood test, every test. And this patient had her records to show me. So anyway, she's in Jamaica. We're talking, and we decided to also run some tests here, and almost everything come back normal, to be frank with you. But one mind just say, first of all, I told her she needed to clean up her diet. Yeah? Stop eating junk, eat, more natural, organic. And I just decided to put her on the vitamin B12, the methylated vitamin B12. Listen, even though her blood work, both in foreign and in Jamaica, her B12 levels were normal. They were normal. But I say, you know what? You don't really have nothing to lose. And I'm telling you, this is a patient who symptoms had gotten so severe at times that she had to go to the ER. That's the emergency room in the States, right? And she was now very worried if they would find some crazy, disease or something very worrisome neurologically in your nerve or your spinal cord or in your brain. She was concerned, for example, about multiple sclerosis, right? Anyway, back to my story. So I said, you know what? You have nothing to lose. I put her on the B12 and I also put her on magnesium, to be frank with you. And people, believe thou me, her symptoms went. She was also having spinal pain. Her symptoms went. Not even me could believe it. And I found it kind of odd because her blood work were normal, like the levels in the blood test were normal. But it says to me that maybe the levels in the blood work are maybe not necessarily optimal for everybody. Because just being on those two over-the-counter vitamins after, years of tests and going to the ER and seeing neurologists, I'm telling you, I don't think it took 1 month. 1 month. So, B12 deficiency is very important. You hear about this in people who don't eat meat, vegetarians. But if you have stomach issues like gastritis or you have celiac disease or stuff that maybe the B12 is not being absorbed properly, right? It can also affect you as you get older too. It comes with aging. Or certain infections make you use up your B12 a lot more, right? So if you think you may have B12 deficiency, it's worthwhile taking one, especially if you're having other symptoms. Tired all the time can make you anemic, when you're low. So if you're tired, you're short of breath, you're having nerve symptoms, your memory, you're moody, depression, anxiety, all of those, even digestive symptoms could be related to a vitamin B12 deficiency. And all that lady did was to take a methylated B12 supplement. And as I said, in fairness, she also got magnesium. And she made almost a complete recovery. I'm still amazed by it. Until next time, this has been Dr. Jen. Bye.